why we don't want these healthcare companies to profit off our bodies anymore. We want universal healthcare so that the playing field gets evened out a little bit, right? One of the ways that we're going to do that is we're going to talk about our own real stories. What has happened to us to make us come to this space and ask for this. So we're going to start out with a local resident who has an amazing story. Mr. Pete Keenan, I'm going to ask you to stop up here and let us know your healthcare story.
Thank you.
Thank you.
Hello, everyone. My name is Pete Keenan. I am the youngest one of 7 kids. Grew up in Elmira, New York. Lived on the south side of Elmira. Graduated from Southside High School. And after I tell you this story, there shouldn't be any guessing as why I'm a rabid environmentalist and why I believe that universal health care is a basic human right. As I said, I graduated from Southside High School. I graduated in 1994. The second half of my senior year, I became extremely ill, and I went from 240 pounds to 160 pounds in the span of about 3 months. It was followed by months of doctor's appointments and illnesses. Basically, what happened to me is that I went from being an 18-year-old kid who could play football to an old man overnight. Basically, my body began attacking itself. None of the doctors could figure out what was wrong. You fast forward to this spring or last spring, and the issues with the toxicology at Elmira High School. I took a PCB toxicity test. It came back positive for 2 different chemicals found in 4 different PCBs, higher than what is expected to be the normal background level. And that is after I graduated in '94, so 25 plus years, because PCBs never flush out of your system. I had my first hip replacement in 2010. I had my second hip replacement in 2017. I have taken so many NSAIDs that I am now allergic to them. I can no longer take them. They affect my stomach and my liver function. In course of treatment, and finally getting a prescription for medical marijuana, tried to go through that process. I was labeled drug seeking by my primary care physicians. They would happily write me a prescription for a narcotic, asking for medical marijuana led down the path of the drug seeking. My first time I went to get health insurance at the age of 19 years old, when my first job, I sat down, filled out my health insurance paperwork, handed it to the HR representative, and got a letter a few weeks later back from the insurer saying that I was denied because I had a pre-existing condition. My pre-existing condition was the health concerns that were caused by the PCB toxicity. So I was exposed to PCBs. They caused irreversible damage in my body. And then because in between graduating from high school and getting my first job, my insurance lapsed, I could no longer get health insurance. Moving forward, I moved to Boston in about 2017. And Massachusetts has something called Romney Care, which is the blueprint for the Affordable Health Care Act. The difference between Romney Care and the Affordable Health Care Act is one basic thing. Every insurance company in the state of Massachusetts, regardless of where you get it, has to ask the Attorney General to raise their rates. So that means the Attorney General of Massachusetts goes to your insurance company, they open up the books, and unless the company spends 80% of their premiums on payments for services provided, they cannot raise their rates. In almost 10 years living in Massachusetts, my insurance rates never went up. My wife worked for a Fortune 500 company in Cambridge, and she had a Cadillac insurance plan. The 1 year that her insurance company tried to raise their rates, guess what happened? The Attorney General went and did an audit of their books, and they didn't spend over 80% of what they took in on claims, so my insurance actually went down. Fast forward to moving to New York State, one of the reasons we could move to New York State in 2014 was because of the Affordable Health Care Act. You're going to see a little curly-haired boy in a minute hand me a phone. My wife became pregnant in 2015. And when she did with Mr. Charlie, she developed gestational diabetes. And because she became pregnant, our health insurance switched, and it went from a gold plan on the exchange to a managed Medicaid plan, which means everything that was covered. And when I say everything was covered, Sarah, my wife, at the end of her pregnancy was going 3 to 4 days a week for IV fluid transfers. Her gestational diabetes was really, really bad. She was on bed rest for most of the pregnancy. When Charlie was born, she had a C-section, and the C-section incision didn't heal, and she was on a womb vac for 4 months. Now, all of that was covered, but it took a lot of doing and a lot of battling with insurance companies to make sure that it was covered. Now, at the same time as Charlie, I was dealing with an infant and my wife in bed with a womb vac, I got a letter from Blue Cross and Blue Shield, which was the insurance company that my wife and I had purchased a plan off of the exchange in 2015 when there was only 4 of us. Before Charlie, my wife got pregnant with Charlie. Now, see, the funny thing about this plan was when I was working, the employer that I was working for had Blue Cross and Blue Shield insurance. They were almost the exact same plans. But the difference was the Blue Cross and Blue Shield plan from the employer was twice as much as it was on the exchange. Not just what I would pay, but the overall plan was twice as much as it was on the exchange. Now, they're the same plans. One costs twice as much because it comes from your employer. I got a letter from Blue Cross and Blue Shield in 2016 that apologized to me because the plan that I bought, they didn't spend over 80% of what they took in on claims. So they sent me an apology letter and a check for $700 explaining that they didn't live up to their end of the agreement. I'm not making this up. That's how health insurance should work. All right? And even more than that, as we move forward, here in New York, where property taxes pay for basic medical services, such as Medicaid per county, the New York Health Act would have the effect of taking that burden off of property owners and transferring it to people who would have to pay far less out of their paycheck than they do right now for an insurance premium. You know, I'm looking at employers, and I received insurance information to start a new job. $350 a month for a high deductible plan for a family, which basically means I'll have insurance in case somebody's dead. That's not right. So I could pay $350 for that insurance, or the New York Health Act can pass, in which case I don't even make close to $50,000 a year. So it'll be less than this, but $50,000 a year would roughly cost maybe $75 to $100 a month, and everybody in the state would be covered. I take that deal as opposed to $350 for bad insurance. So that is my story. I'm not the only one who's gone through this. We all know people that don't go to the doctor because they can't afford it, or don't get their medicine because they can't afford it. You know, a GoFundMe account isn't a reliable health insurance plan. And in New York State, it's written in the Constitution that we are guaranteed the right to health. Doesn't get any more guaranteed than guaranteed health insurance across the state for everyone. Thank you.
Thank you so much. We really appreciate a pre-existing condition of going to school. He went to high school, so if he has a condition, that's and I'm pretty sure you probably have PTSD when it comes to going to your mailbox. I'm sorry for that. That's just not... Dude, like how many parts of that